This is a presentation on lactation pearls for bonding, latching, and positioning. My name is Holly and I will be providing the presentation today. New parents feel pressure when learning the techniques and rhythm of nursing. They stress out about how to make the baby latch and nurse. Dispel feelings of pressure. Help them understand their role is to create a relaxing nursing environment. They can learn their baby's hunger cues and become in sync with their baby. They can help their baby relax prior to nursing by doing things such as eye contact, talking or singing to their baby, skin to skin, or rocking their baby. Remind parents that babies are hardwired with innate behaviors to nurse. Separation hinders bonding in nursing. The 30 minutes after birth is the optimal time for nursing. Babies are most alert and active in the 2 hours after birth. Routine care prioritizes procedures over bonding and nursing. Separation of the infant mother-parent dyad interrupts the initial bonding period, decreases parent self-esteem, and hinders the nursing success. For the infant, separation causes stress on the infant, fussiness and increased crying, and increases their risk of insufficient nutrition and non-exclusive nursing. Protect the bonding period between the infant and mother or parent to encourage lactation success. Immediate, uninterrupted skin to skin improves outcomes. It's beneficial regardless of feeding method, whether nursing or bottle feeding. Infants have the physiological need to be in contact with their mother or birthing parent after birth. Protect this uninterrupted hour. Skin to skin increases sensitivity to the baby's needs and secures bonding. One study showed that the mother-infant skin-to-skin contact had significant statistical effect on the success rate and duration of first lactation compared with routine care. Skin to skin can be defined as the placement of a naked infant, occasionally with a diaper or cap on its mother's bare skin, and the exposed side or back of the infant covered with a blanket or towel. Multiple professional organizations recognize the benefits of skin to skin after birth. The World Health Organization states that all healthy infants should have 1 hour of uninterrupted skin to skin immediately after birth until the first nursing session. The American Academy of Pediatrics, as well as the American College of Obstetrics, support immediate skin to skin and state all assessments can be done during the skin to skin or can be delayed until after this important shared time between the parent-infant dyad. So why is the initial 1 to 2 hours after birth sacred? Infants have a short burst of catecholamines for 2 hours after birth. It's fascinating that this hormone increases in the second stage of labor due to fetal head compression and intermittent hypoxia during uterine contractions. Increased circulation of catecholamines increases the baby's sense of smell to find the nipple to nurse. After 2 hours, the catecholamine level decreases, which is why babies fall into a deep slumber for 3 to 4 hours after birth. Once babies are in their sleepy phase, it will be difficult to arouse the baby for an initial feed, and attempts for latching and nursing will be impaired. Interestingly, the mother's sense of smell is also heightened after birth, and it's the primary sense that stimulates oxytocin release, meaning oxytocin increases the most after birth when the birthing parent smells their baby. Increased oxytocin secretion and prolactin increase milk supply and production, which is why bonding and skin to skin is so important. The benefits of skin to skin are numerous. The benefits for the mother and birthing parent include increased bonding, increased uterine contractions that aid in the placenta delivery, it reduces bleeding and hemorrhage risk, it enhances the parent confidence in breastfeeding and chest feeding, and decreases stress levels of the mother and birthing parent. Benefits for the infant include it decreases the negative effects from the stress of birth. It regulates the temperature and respiration of infants. It decreases the amount of infant crying. It increases the rates of initiation of nursing and also exclusive nursing rates. It encourages intuitive behaviors after birth in the infant, such as breast crawl, rooting, and attachment. It heightens the infant's coordination of their five senses: sight, hearing, touch, taste, and smell, which helps with their movement. Skin to skin initiates the 9 instinctive infant stages described by Widstrom. There are 9 stages present with instinctive behaviors infants progress through with uninterrupted skin to skin and unmedicated births. These 9 stages and behaviors are used as a measurable reference in studies to demonstrate the interference of birth interventions. The 9 stages include birth cry, relaxation, awakening stage, active stage, resting stage, familiarization, suckling stage, and sleeping stage. The resting stage can be interspersed with all the other stages. There are 20 primitive neonatal reflexes. As the slide demonstrates, there are several reflexes that can be observed that we do not test for. Newborns use all their senses and reflexes to understand the world around them and support their drive for nourishment. You can promote breast crawling and latching with nursing positions. Research shows improved nursing outcomes when infants breast crawl within 1 hour of birth. When babies don't breast crawl, it is linked to increased nipple pain and delayed milk production. Even a short separation or pain medication can hinder instinctive breast crawl behaviors. When the infant is skin to skin and belly down, it activates their intuitive feeding behaviors. Laid-back nursing positions support the primitive neonatal reflexes. And semi-reclined nursing promotes breast crawling, deep latching, and decreases stress during feeds. Infants are innately designed to breastfeed on their abdomens. Laid-back nursing positions assist in self-driven infant feeding. It allows the infant to get a deeper latch that causes less nipple pain, and the infant's posterior head tilt allows for easier coordination of swallowing. In a semi-reclined position, the infant would be positioned tummy down with full body contact against their parent's body. Touch also stimulates feeding reflexes, especially foot contact. So the infant's foot against the parent's body or their legs stimulates the infant's feeding behaviors and also helps them move up towards the nipple. These pictures demonstrate examples of semi-reclined nursing. Doesn't it look more comfortable? In conclusion, infants instinctively know how to nurse. Nursing works better when we support newborn feeding reflexes. Skin to skin promotes parent-infant bonding and early initiation of breast and chest feeding. Protect the sacred hour after birth with uninterrupted skin to skin until baby nurses. Skin to skin and semi-reclined positioning promotes the activation of up to 20 neonatal reflexes and 9 infant stages, including the breast crawl and nursing. Skin to skin benefits are numerous for the infant and the mother or birthing person, with significant evidence to support it being implemented in all birth scenarios and healthcare settings. These are my references for my presentation today. I hope you learned a few things and enjoyed the presentation.